Okay, so let's do a crash course over the thyroid hormones. So thyroids are actually responsible for releasing three major products, including T3, T4, and calcitonin. Thyroid hormones are very important, especially to carry out normal functions in the body. If you don't have an appropriate amount, a regulated amount, you actually won't be able to survive if you have too little or even if you have too many. So let's talk about how thyroid hormones are secreted and produced in the body. This is my little brain, and we'll actually start with the negative feedback. So in case you don't know what negative feedback is, it's basically your body signaling that something is too low, that something is missing, and needs to be replenished in the body. So your body sends a signal to the hypothalamus, the negative feedback signal, that something is missing, something needs to be replenished. So in this case, we're talking about the thyroid hormones, and let's say they're too low. The hypothalamus then triggers the release of TRH, which stands for thyroid releasing hormones. That's another way to remember it, thyroid releasing hormones. And then the thyroid releasing hormone then signals the pituitary gland to release TSH, okay? And so a trick that I do to remember which one comes first is just alphabetical order. So QRS, so R comes before S, so that's how I remember. So you need the thyroid hormone to release first, and then for it to be secreted, if that helps too, and then I numbered it. So the TSH then goes over to the thyroid and signals the release of it to produce more T3 and T4. Okay, so let's go over here. So like I said, you can have too much thyroid hormone, or you could have too little. So we know hyper means that there is an excessive amount or an increase in something, and then hypo means that there is a reduced amount and not enough of something. So let's start with hyperthyroidism. This is how I remember it. So when you think of hyper, I think of everything is elevated. So when everything is elevated, think of like you might have an increased appetite. Your metabolism is elevated, so you're going to want to eat more. And if your metabolism is elevated and your food is metabolizing faster, what do you think is going to happen? You're going to lose weight, right? And if everything else in your body is metabolizing, so like the proteins and the nutrients, that leads to an increase in like hair and nail growth. So now the psychosocial part of it, anxiety. I think of like being really, really anxious, like just find keywords. So hyperthyroidism, I think of being anxious. So anxiety, when you have anxiety, do you think you can sleep? No. So, and you usually have insomnia. Also think of sweating as well when I think of anxiety, because I think of like when you're real anxious, you're kind of nervous. So think of sweating, and then you have diarrhea because everything is metabolizing super fast. So if you can get this down, then it'll be really easy to remember. Hypothyroidism, because it's literally the complete opposite of hyper. So everything is going really, really slow, right? Because you are lacking. So you are going to have a decrease in appetite. Your metabolism is moving slow. So even though you have a decrease in appetite, you're still metabolizing food slow. So you have an increase in weight gain. A decrease in hair and nail growth. Psychosocial, so for hyper, it was anxiety, but if everything is moving slow, think of depression. And another way I remember that depression is psychosocial for hypothyroidism is I think of like when people are usually depressed, one of the main signs and symptoms is they have a lack of appetite, or they usually like gain weight from a lack of activity. So that'll help you remember too. And then mental fog, so memory loss, and then opposite, so sweating, dry skin, and opposite of diarrhea, constipation, right? Levothyroxine. So with hypothyroidism, remember you're having you are lacking in thyroid hormone release, like you don't have it. So think about the mechanism of action here. So if you need something, what do you think you're going to be doing? So you're going to be replenishing. So for levothyroxine, you're going to be replenishing the T4 hormone in the body to make up for what's not being produced and secreted. I have Synthroid here because Synthroid is the brand name for levothyroxine. And you can use them interchangeably, but the main thing you want to remember about the difference is that the dosage and the fillers. So for levothyroxine, It is like, I think this is the generic brand. So it has more fillers in there to help with improving the absorption of the medication. And the dosages also vary by different brands when you use levothyroxine. But with Synthroid, it stays the same across the board. The filler amount stays the same and the dosage is always the same. So just remember that. Key teaching points as a nurse: remember to tell a patient to take this medication at the same time every day, preferably in the mornings. And this is also something that they will have to take for the rest of their life. They will be taking this forever. When you are checking labs, you want to monitor for TSH, because remember, as we said over here, TSH is the main thing that is helping to produce more of the thyroid hormones. That's like the last signaling point, the last point of contact to produce thyroid hormones. So let's backtrack really quick. So when you think of hypothyroidism and you need more hormones, you got to think about whether the TSH is going to be higher when you check the labs or lower. It's going to be higher because the body sending the negative feedback to the hypothalamus is going to signal the release of more TSH because it's trying to replenish for what you are lacking, which is the thyroid hormones. When you think of hyperthyroidism, the TSH is going to be lower because your body gets a signal that, okay, I have too much of this. I need to kind of maintain some kind of homeostasis. So it'll kind of try to slow your body down, which will slow down the production of TSH, the release of TSH in the body. So it'll actually be a lower TSH with hyperthyroidism and then higher TSH in the lab. So you have hypothyroidism. A major adverse effect is excessive dose of the levothyroxine can lead to signs and symptoms of hyperthyroidism. So if you have too much, like you overdosing on it, or you're taking too much, the dose is too high, you're going to have too much thyroid hormones secreted in the body, which is going to lead you to have signs and symptoms of hyperthyroidism. So it makes sense. Okay, so the other drug is propylthyracil. I think I said that right. So this is the drug for hyperthyroidism. You have hyperthyroidism, you have too many thyroid hormones being produced and secreted in the body. So it's going to actually inhibit the release of thyroid hormones. It does not interfere with thyroid hormones that are already produced and just stored in the body. So if it's already there, it's not going to interfere with any of that. It's not going to mess with any of those. It just interferes with the production of new hormones. Patient teachings let the patient know that this drug does alter the metabolism of other drugs. So you may have to get dosage changes by the provider on like other medications that you are taking, just to make sure that they have a therapeutic effect. Adverse effects: liver damage. So you want to look out for signs and symptoms like the skin yellowing. You also want to check liver labs, liver functions for this, and GI upset. One more drug we're going to talk about for hyperthyroidism is radioactive iodine. So you swallow this drug. It is not to be used for children, administered to children. And it's just 3 major things to remember. 6 to 23 days, you want to avoid sleeping next to pregnant women or kids. Up to 21 days, sleeping next to pets. And 3 to 11 days, you want to stay 6 feet within 6 feet away from other people, especially in public transport areas.